Well, for things like panic attack disorders,
Yeah.
and OCD, there are a lot of modalities that can make it worse. And a
Talk
couple,
therapy, one of them.
yes, yeah, we talked about this on the show a couple months ago. We had a Dallas Therapeutic Services, and one of their owners does a lot of work with OCD,
Yeah.
and her and I were talking about that, about how traditional just talk therapy, talking through things, can make it worse. And so for those listening, it's like this is why we bring on so many people with different experiences, is because you got to be able to get out there and kind of know what you're looking for, and know, if there isn't these conversations, people are just kind of shooting in the dark.
Exactly. And unfortunately, in graduate school, you don't learn a lot about OCD, and so it's tough because some therapists think they say they work with OCD, but they maybe just know a little bit about OCD, and it's where they have to get those trainings for like exposure response prevention, because that is the golden standard treatment for OCD. And I didn't know about that, so I only got diagnosed in 2019. It took me years, but I finally got it. But also, it's important to know when it comes to like panic disorder specifically, because I've struggled with panic attacks for 13 years, and it's like, why? And that's how we found out, well, there's trauma. Like, you need to get to the root of like, why is this happening constantly? And I think that's also important for people to know. Like, we need to get to the root of what is causing these panic attacks.
Yeah, it'd be like a math equation. First order of operation is ERP. Second order of operation would be whatever trauma modality to get those roots kind of nourished.
Exactly. Yeah.
It's and then more order of operations from there. But yeah.
Yeah, I think there's a saying like, don't have too many cooks in the kitchen. Like, having too many therapists can be hard, but there's also sometimes it's okay to have like maybe an ERP therapist and a trauma like EMDR, because they tackle different modalities.
Yeah, my specialty is working with addictions and family members of those struggling with addictions.